The World Health Organization, or WHO, is warning that the 2019 acute respiratory disease outbreak could be more powerful than terrorist attacks.
The organization is now urging countries to step up the fight against the disease, especially those with weaker health systems. Here's the report.
The World Health Organization officially names the new coronavirus COVID-19 just after the death toll breached 1,000 people. WHO Director General Tedros Adhanom Ghebreyesus said the name had been chosen to avoid stigma on people or places.
We had to find a name that did not refer to a geographical location, an animal, an individual or group of people, and which is also pronounceable and related to the disease. Having a name matters to prevent the use of other names that can be inaccurate or stigmatizing.
WHO also assured the public that the first vaccine targeting the new coronavirus will be available in 18 months. Tedros said they're still following a containment strategy against COVID-19, which they branded as public enemy number one. He also called for countries to be as aggressive as possible in fighting the outbreak, as WHO believes the SARS-like disease is posing a grave threat for the rest of the world.
A virus can have more powerful consequences than any terrorist action. And that's true. And if the world doesn't want to wake up and consider this enemy virus as public enemy number one, I don't think we will learn from our lessons.
WHO is now urging countries to step up measures to detect and contain the virus, especially those with weaker health systems.
With 99% of cases in China, this remains very much an emergency for that country, but one that holds a very grave threat for the rest of the world, unless we use the window of opportunity that we have now.
U.S. Centers for Disease Control likewise warned the public that the novel coronavirus is more transmissible than SARS, despite it being less fatal. Deaths related to the disease make up 2% of the infected population. The mortality rate in SARS was around 10%.
We are learning more and more each day about this virus. We think that in many respects, the spread of the virus is through respiratory droplets, similar to what we see with seasonal influenza, similar to the vast majority of spread of the SARS virus that this has been compared to. But we don't have as much information as we would like about the severity of the virus.
Meanwhile, Anthony Fauci, top infectious disease official in the U.S., said that the coronavirus vaccine may not be available in a year. The agency, however, has a plan to possibly fast-track vaccine production against COVID-19.
So the quickest scenario that I could see is if this really turns out to be bad, which we all hope it won't, that what we do is that when we get to the point of the 6 months of the end of the phase 1, that you proceed, what they say in the industry, at risk. And proceeding at risk means you invest hundreds and hundreds and hundreds of millions of dollars to scale up on something that you hope might work.
And forget the rumors circulating online, because health officials have clarified that the COVID-19 is not airborne. JC Cosico has the details.
Marilyn sells goods near San Lazaro Hospital in Manila, where nearly 400 persons are being monitored for the coronavirus disease or COVID-19. And fearing that the disease is airborne, she opts to wear masks on a daily basis.
May mga bumibili sa amin na siyempre galing sa loob ng ospital.
Both the Department of Health and the World Health Organization dismissed reports of COVID-19 being airborne, citing lack of evidence.
Our evidence is that it's still largely a droplet infection. So I'm not quite sure what led to this rumor.
Studies show that COVID-19 is transmitted through droplet infection and through close contact with infected people. Health officials also say that COVID-19 is easier to treat than the 2003 SARS and MERS-CoV. And despite exceeding the number of SARS cases, mortality rate for COVID-19 is still not as high as the previous pandemics.
Numerically, we are seeing more deaths, but if you look at the rates, it's much lower. This time around, we have 5 times as many cases already confirmed, 40,000, and we have just 1,000 deaths.
But the health department admits that it would be a problem if the virus mutates.
Now, the question is, to what extent is the mutation going to reach? Nobody knows. Yan ang malaking blind spot. And thus, people tend to entertain all these haka-haka.
The WHO says scientists are doing their best to produce a vaccine against COVID-19, but we might have to wait for at least 18 months before it could be available. For News 5, JC Cosico, we are One News.